Okay, so you've just had surgery. You're probably keeping a close eye on everything, making sure you're healing up right. But, recovery isn't always a perfect straight line. So let's talk about one of the most common and kind of surprising things that can pop up.
Right. The surgery's done, you're finally on the road to recovery, and then you notice it. There's a new lump, maybe some swelling, right near your incision. And look, it's totally natural to feel a little worried when you see something you weren't expecting. So let's dig into exactly what that might be. First up, let's talk about the post-surgery surprise. Because let's be real, finding a new bump when you're supposed to be healing can definitely be a bit of a shock. The very first thing you should know is that this is super common. In fact, more often than not, it's just a normal part of how your body heals itself. You are definitely not alone in this, and we're going to walk through it together.
So what is this bump anyway? In the medical world, it's usually called a seroma. Let's break down what that fancy word actually means.
So at its core, a seroma is really just a pocket of fluid. Think about it. When tissue is removed or moved around during surgery, it can leave a little empty space behind. And sometimes your body's natural healing fluids just kind of pool in that space. That's what creates the lump you're feeling.
And what is that fluid exactly? Well, it's called serum. It's basically a mix of lymphatic fluid and blood plasma. You can almost think of it as the body's repair crew, all gathered in one spot to do their work.
So just how common are we talking here? Get this. After certain surgeries, like mastectomies, some studies show that as many as 85% of people get a seroma. Yeah, 85%. It's honestly one of the most common things that can happen after an operation.
All right, so let's talk timing. When do these things usually show up? Typically, you'll start to notice a seroma about a week to 10 days after your surgery. But here's the really good news. In a lot of cases, your body just takes care of it. It'll reabsorb all that fluid on its own. Now, it might take a few weeks, or sometimes even a couple of months, but it often just goes away.
Okay, so how can you be pretty sure that the lump you're feeling is a seroma? Let's go through a few ways you can check at home.
You can do a really simple check yourself. First, just look for that swollen lump. It might feel a bit tender or sore, and that's normal. Then, and you want to be gentle here, try pressing on one side of it. If you feel a little wave or a squishy, fluid-like movement under the skin, that's a really strong clue that it's probably a seroma.
And this brings us to a really crucial point. We have to be able to tell the difference between a simple, harmless seroma and something more serious, like an infection. Knowing what to look for is absolutely key for a safe recovery. Let's put these side by side. A normal seroma, it's that swollen, tender lump, kind of like a cyst. You might see a little clear or slightly pinkish fluid, but an infection, that's a whole different story. You're going to see redness that's getting worse, and the area will feel warm. The discharge might change color or start to smell. And the pain isn't just tender, it's getting worse.
So, what happens next? Let's get into how seromas are usually treated and what potential complications you need to have on your radar.
So, here it is, probably the most important thing to know about treatment. The most common course of action is, well, to do nothing at all. Your body is an incredible healing machine, and most of the time, it just handles these small seromas all by itself.
So what does that look like in practice? Well, for the vast majority of people, we're talking 60%, the best treatment is just time. Your body's got it. Now, for bigger ones or ones that are just really stubborn, a doctor might need to drain the fluid with a needle. That's called aspiration. And then, in pretty rare cases, a small surgical procedure might be needed.
Now, the single biggest risk with a seroma is that it could get infected. If that happens, it can turn into something called an abscess, which is a pocket of pus. This is much more serious, and it absolutely needs medical treatment, which usually means draining it and getting on some antibiotics. And that brings us to the most critical part of this entire guide. Knowing the signs. Knowing when it's time to stop the wait-and-see approach and pick up the phone to call your doctor.
Look, this isn't about causing alarm. Not at all. This is about being empowered. Being able to spot these red flags early is the single most important thing you can do to make sure your recovery stays safe and on track.
Okay, take a really good look at this list. These are the signs. If you get a fever over 104.4 Fahrenheit, if the swelling or the pain is getting worse and fast, if you see drainage that's white or bloody or changing colors, these are your signals. Also, skin that's warm to the touch around the area, a really fast heart rate, or feeling confused. Don't wait. Call your medical team right away.
And finally, please, this is a non-negotiable safety rule. Do not, under any circumstances, try to drain a seroma yourself. Poking at it or squeezing it is a surefire way to introduce bacteria and cause a really nasty infection. This is a job for a doctor or a nurse, period.
At the end of the day, you are the most important person on your recovery team. Being informed and paying attention is your superpower. Now you know what a seroma is, and, even more importantly, you know the warning signs to look out for. Your recovery really is in your hands.